Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General.
Hi everyone, my name is Addie. I'm a senior at Boston University and I'm also interning at the Blum Center.
Thank you, Addie. Before I get started, I just want to go through the items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, they'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has muted so we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I'm going to turn it over to Addie, who will introduce you all today's guest speakers.
So joining us today we have Lisa DuBreuil. She's a licensed clinical social worker with the Department of Psychiatry. We are also joined by Katy Wetzel. She's a certified intuitive eating counselor with interventional cardiology. In recognition of Black History Month, they are here today to give a talk on the racist roots of diet culture. Please join us in welcoming Lisa and Katy.
Hi, we're so glad to be here today.
Indeed.
Okay, well, let me get the slides started. All right. Okay, so we're very pleased to be here today to talk about this really important topic. I just want to introduce myself. So as I was introduced, I'm a clinical social worker here at Mass General. I'm a therapist and at West End Clinic in outpatient psychiatry, and I have some expertise in weight stigma, eating disorders, body image distress, addiction, and trauma. I'm also someone who identifies as being fat. I'm white, I'm Christian, I'm cisgender, I'm highly educated. I have some generational wealth, and I was born and raised here in Boston, and I am disabled.
Hi, I'm Katy Wetzel. I'm a nurse practitioner with the Interventional and Structural Service here at Mass General. I work on the inpatient side, and I have, after years of recommending diets to my patients and to myself, and having been recommended diets for years, I realized that I was a dieter and had a disordered relationship with food. And I have since then become a certified intuitive eating counselor. And I sit with Lisa on the size diversity group here at Mass General, and I've done some lecturing on this matter. I'm also a body trust provider. And if somebody wants to reach out and has any questions about that, I'd be happy to talk about it. I also have a lot of privilege. I am a thin white lady. I'm cisgendered. I am well educated. And so I have the fortune to be able to push back against some of the thinking that goes on in my life and in our institution. And I am interested in turning the tanker on our mentality here.
Okay. And we also want to be really clear as two white women, what we're not here to do. So we're not experts on racism. We're not experts on Black cultures or foodways, and we're not here to tell anybody what to do. We want to give people some information, some resources, maybe give people a different way to think about certain things that have to do with our bodies and our eating. So we're hoping to be very mindful and on top of sort of staying in our lane. And, as always, a lot of times these are topics that can be uncomfortable for people, and bring up questions or concerns. And so we really want to acknowledge that, and that we, understand that and are ready for questions, comments, concerns, skepticism. We hope that this will this talk will give people a lot of things to think about. And if you have questions either now or later, we're really happy to hear them. So the first thing we want to talk about is this concept of diet culture. You may have heard that term, you may not have, but want to talk about what we mean by that. And depending on what identities and privileges we have and don't have, diet culture is going to impact different people in different ways. So, diet culture, what exactly are we talking about here? So, diet culture, it conflates health and size, and so it pathologizes some body sizes or body shapes. It encourages following external rules about what to eat, when, how much to eat. It suggests that people are more or less good or moral or worthy, based on their body size or shape. And it creates thin privilege. It makes thinness a gatekeeper for jobs, benefits, comfort, and accommodation. So, it presents movement, physical activity, exercise as punishment for prevention of being fat, rather than for other reasons like having fun or personal goals. It views fat people as less valuable, more riskable. It's permeated by discussions of food, weight, exercise, diets, and the right to discuss these things in every environment is fervently defended. So diet culture leads to disconnection from our bodies, disconnections from our internal cues about whether we're hungry or not, what kind of food we are hungry for or not. It contributes to the stigma that people experience around their body size. It increases or causes body image distress, feeling discontented, unhappy, or ashamed of our bodies and how our bodies look, and absolutely contributes to the development of disordered eating and, clinical eating disorders. And it's really important to be aware that there's a lot of money being made on diet culture and medicalizing larger bodied people. I just looked this up a few days ago. Just in the US alone, we're looking at $90 billion a year of money being made off of different ways of pursuing weight loss. And it's expanding at a compound annual growth rate of 8.2%. So there's a lot of money to be made off of people being unhappy with their bodies. And so what do we mean when we use the term weight stigma? Weight stigma is about the negative attitudes that affect interactions between people. And it can have very subtle expression of this stigma or very overt. So when we look at weight stigma or weight bias and health outcomes, what we see is that when people are in larger bodies, we see an association with the delay and avoidance of healthcare because people don't want to, I'm going to go see my doctor. He's going to say the usual thing that she always says. I don't want to hear it. We know that stigma, social stigma like weight stigma, is as significant as someone's socioeconomic status in influencing population health. We know from the research that weight stigma decreases activity and exercise levels because people feel ashamed and they don't want people staring at them or ridiculing them or giving them a hard time. And we know that medication dosages can be incorrect for larger bodied people. And there's a growing amount of literature, research looking at the bias that doctors and other medical providers have against larger bodied patients. This is just one study looking at doctors, and it showed a strong implicit anti-fat bias and a strong preference for thin people. We know that just like the rest of us, doctors, nurses, dietitians, etc., we're all living in the same culture, in this diet culture, and medical providers are just as impacted as any other group is by this. And then when we think about psychologically, weight stigma increases depression, anxiety, lower self-esteem. There's an increase in suicidal acts and thoughts for some folks, and poor body image or body distress. And so all of these different things make it harder for people to take good care of themselves, which then has impact on their health. And it's really important to understand, Professor Crenshaw's concept of intersectionality, right? Understanding how different identities around race, class, gender, body size relate to systems of oppression. And because the idealized body in Western cultures like the United States is a thin, white, physically able male body, the farther you are away from that ideal, the more oppression and prejudice you're likely to experience. Okay, so what that means is that, for example, a majority of Black and brown women in the United States are dealing not only with racism and sexism, but also weight stigma and possibly also other oppressions. So this means that, diet culture and weight stigma harm Black people significantly more than white people because they're not protected by whiteness. As Katie and I referenced, we both have lots of privileges. That helps, for me, helps protect me against the harms of weight stigma or weight bias. But people without my privileges don't have those protections. And so they're more vulnerable to the harms that weight stigma causes. And so increasingly, people are seeing how diet culture is one of the ways that anti-Blackness shows up in our culture. And this is one of my favorite examples. Here is Serena Williams, arguably one of the greatest athletes in modern history. Her incredibly powerful, capable, skilled body, and she got photoshopped for this ad. So if her body and what she's capable of in that body is not good enough, as far as diet culture is concerned, even her body needs changing in order to be acceptable. And so to talk about the connection here, one of the ways we think about this is that anti-fatness is a form of anti-Blackness. And this is beautifully explained in a very important book by Dr. Sabrina Strings, Fearing the Black Body, which came out, I want to say 5 or 7 years ago. But Dr. Strings, who's a researcher, she talked about how racism is the missing element that explains the origins of fat phobia and the development of the slender ideal in Western culture. So she talks about, race was used as a double agent. It entails the synchronized repression of quote unquote savage Blackness and the generation of disciplined whiteness. So this thin ideal that started developing after the transatlantic slave trades was a way of morally separating white women from Black women and allowed a rationalization for why slavery, chattel slavery and all the horrors that came out of that were justified because these unruly, large Black bodies were evidence that these were peoples that needed to be controlled. And Deshaun Harrison, another really wonderful writer, has talked about and written about how, this anti-fatness as anti-Blackness is used to justify police violence. And we've seen this when we see how Black men in particular, the violence perpetrated on them. Some of the rationalizations have included, well, look at the size of them. Eric Garner, I know there were people saying that that his body size was the reason why he died, not the way that he was treated by the police. And so this is another example of how this shows up and does harm to Black people in particular. So Deshawn asks us, what would it mean for us to lean into insecurity as a political tool in which we free ourselves with insisting that we perform perfection and total confidence in order to advocate for our collective liberation? So we would like to offer some other ways of thinking about our bodies, our health, and our cultures so that more people feel and are, safe and included and feel respected and heard, safe in their bodies and feeling respected and heard. And Katy, I think this is where you're going to take it
Great.
from here.
Yeah.
Yeah.
And I love that quote about Deshaun Harrison talking about how our perfection is really causing harm. And that's how I found this work. I was viewed as having a lot of privilege and thin, and I was a nurse practitioner in cardiology, and I knew so much, and I was giving all this diet advice. In actuality, I was a complete fraud because I had a disordered relationship with food and I was causing harm. And when I found this work, I really unpacked how my privilege was corrupting the platform that I had to cause some radical love to people's bodies and good medicine. And so one of the ways that I sort of relearned and unlearned my role in diet culture is through the intuitive eating model, which is not new. Their initial book came out in 1995, 2005. This is not new. So Evelyn Tribole and Elise Resch are two dietitians who found that they had a lot of clients who had a very untrustworthy and disordered relationship with their body. And so what they found is that people had lost the ability to be in touch with their own body, to know when they were hungry and when they were full, and they lost that trust. And so through their model, which if you want to advance, Lisa.
Oh, yep.
Right. They came up with a philosophy of 10 principles of intuitive eating. And what I love about the philosophies of intuitive eating, the hub of it is satisfaction, and that we are supposed to have joy with food. We are supposed to share food with people that we love. And that's how we make connection. And that's how we were hardwired to survive as a species. If you were with your tribe headed through the Kalahari Desert, you didn't need a water bottle with 10 ounces of water every hour and a half. You could survive with just a few drops of water. And you could survive with that glorified, rich, eating, joyous slaughter that you got after hard work. And when you got that eating, you were supposed to binge. You were supposed to be very, very full, because that's what fueled you for the next 10 days of no food, no water. And that's how we survived. And so what people have done is they have questioned their own relationship with food, that people have been told that when you're hungry, are you really hungry or are you just thirsty? And if you're hungry, you should have something to eat. Our bodies, when we are 2-year-olds, have that innate understanding of what our bodies need. If you watch a 2-year-old eat, sometimes they'll have a carrot, sometimes they'll have a cookie, sometimes they won't have anything, sometimes they'll have a lot. They listen to themselves. They are not judging the size of their thighs to decide whether or not they're worthy of a cookie. So these are the 10 principles of intuitive eating. And the very first principle, which is the hardest to understand, and it comes up for me again and again and again, was actually to reject the diet mentality, which, as Lisa talked about, it is so pervasive. And it is how we are practicing medicine by judging bodies as good and bad, and how we speak to ourselves in terms of whether we are worthy of having lunch or not, which is just ridiculous. So do you want to?
Mm-hmm. Yep.
So what intuitive eating is not, it is not a diet. It is not a protocol. It is not a plan. It is not a cleanse. It's not something that you have to wait to get through the wedding season to start. It is something that you can get in touch with right now. And what it is not is, it is not going to tell you that you should only eat when you're hungry. It's not going to tell you that you should only eat that you should stop eating when you're full. At Thanksgiving, we're supposed to be over full. That's a joy. It doesn't mean that birthday cake is any more devious than a carrot. It does not say that one food is good or one food is bad, which doesn't mean that if you are just coming into intuitive eating or getting back in touch with your relationship with food, you may eat a lot of cookies. I know I did. There were years where I had to keep buying that box of cookies and keep buying that box of cookies so that my body could trust me that we would always have cookies and that they weren't a treat. There's nothing wrong with eating a cookie. And it's only when you eat cookies every day that you realize, I don't even like those cookies, or I can have that cookie anytime I want, that the cookies lose their allure. There will also be a time that you want a vegetable. If anybody's gone on vacation and you come home after eating out every meal, you might come home and say, wow, I really could use a big salad. There's nothing wrong with wanting a salad or that you have to have a salad every day. It's just a salad. Intuitive eating is not going to make you lose weight. It's not going to make you gain weight. We don't know what your body is going to do. And so it's hard for people to just accept and allow their body to end up where it's going to end up. But we don't get to decide. As much as we want to be in a different size jeans, we don't get that control. And so letting your body be your body truly can bring some satisfaction into your life, some joy into your life, and also just the amount of bandwidth that people get when they stop that tug of war with their body. You want to?
May I add one thing to
Yes,
that, Katie? Would that be okay?
of course.
As a therapist who talks to people a lot about moving into a more intuitive way of taking, of eating and learning how to reconnect with those appetite signals in our body that we've been ignoring for a really long time. One of the ways I try and help people understand this is, you know, your our job together, or your job as someone who's making changes, is to learn how to take really good care of your body and feed your body and rest your body and move your body and all of that. And then your body is going to decide what size it wants to be, given your genes, given everything you've been through in life, given how you're taking care of yourself, given your health issues, and it's sort of like letting your body take care of that piece, and you're going to focus on the self-care stuff and the stress management stuff. And that can be really hard to let go of that, like, but I want to make my body be a certain size. And it's, part of moving out of diet culture is sort of letting that go, and because it's not a battle you can win, and so and letting your body do that piece while you focus on these other pieces.
Thank you. Yes. And while I first came to this work and got to know Lisa through my own struggles with a disordered relationship with food, that was my gateway drug to what is actually important, which is what the stigma and the harm that is caused by diet culture. And so what we find is that, and in medicine, that we talk about how people should eat more fruits and vegetables and go for a walk. And that is actually a very small, very, very small percentage of how your health is determined. And the determinants of health, which is this is what is actually going to make someone healthy or unhealthy, are much more nuanced and much less alterable. So what body you were born with, your genes, how much money you make, where you live, do you have access to clean water? Does a working mom have access to childcare? Do you have healthcare insurance? Are your medications covered? Do you speak the language that is being spoken in your healthcare setting. All of those things are much more important in terms of preventing disease and making someone healthy instead of the very small amount that we ask people to try and attain. I love this slide that when people come in with a problem, they have high blood pressure because they are unable to take their medicines because they're unable to afford their medicines, and they are back in the emergency room, and they've lost their job, and maybe they lost their job because they tried to go to a doctor's appointment and they end up back in the emergency room. We say, you know what, you should have some more vegetables. That is just not helpful and leads to people not coming back in for care. And so when we step back and we ask people, what can we do? What can we do to help you? Not even help you. What can we do? And just listen. And then meet them where they are. And this has now been proven with some recent research that if you give people access to food without judgment of what kind of food it is, they have better diabetes control. Because when a body is starved for whatever reason, because they're walking through the Kalahari Desert, or because they can't afford food at the grocery store, or because they're not eating so that they are able to feed their children, their glucose control is out of control. If you give them access to food, their body will be satisfied because it is being fed. And that will allow them to have better glucose control. We need to be giving people medications that are affordable, that are explained in their native language, that are easy to take, that can be taken once a day. And we need to, when we are giving dietary advice, that we need to understand where those, where patients' dietary history lies. And that's really what we want to talk about today as for Black History Month, that we need to accept people's culture and their food within their culture so that they can be nourished and fueled. Switch. So there are some specific ways in which Blacks in this country in particular are additionally stigmatized. Their BMI is higher, which they are automatically then considered unhealthy, when in actuality, that's some folks' genes. The Black woman's pregnancy mortality risk is 3 times higher than white women. And that is and that's even corrected for socioeconomic status. So there is some bias. There is the drug overdose rate is higher for Blacks, and yet the access to mental health is lower. There is an increased risk of diabetes and high blood pressure and coronary artery disease. And in coronary, I work in cardiology, we now understand that diabetes is not a disease of a poor diet. It's a disease of poverty and a disease of oppression. Yeah.
So I think this is where we switched over. Yeah. So, it's really important to ask these questions, in our culture, who gets to decide what foods are healthy or unhealthy? Where and the answer very simply is white people get to decide. And I think we really need to, we meaning those of us who have power and privilege, really need to start thinking about, um, why that is and how helpful is that, and how it impacts other cultures and other peoples. And this is a book cover from Michael Twitty. This is a beautiful book. It reads like a novel. It's a story about his life and his growing up. And he's a culinary historian as well as a chef, and he specializes in teaching people about cooking by enslaved peoples. And it's just, really wonderful, and for me, a different way to think about food and food cultures. And we know that right now, the just looking at the Academy of Nutrition and Dietetics, 80% of RDs are white. And that doesn't mean they're bad people and they're trying to cause problems, but you're going to get a very specific lens on eating and food choices when you've got 80% of them 80% of anything being all one thing, like everyone being white. So, we need more voices at the table, so to speak. And you can, once people are aware of this and aware of the imposition of outside rules and expectations, you can start to choose not to allow diet culture to interfere with your relationship with your food culture, which is incredibly important for people. So food culture refers to the practices, attitudes, and beliefs, as well as the networks and institutions surrounding the production, the distribution, and the consumption of food. And it's the connection, beliefs, and experiences that we have with food and our food system. And it incorporates our cultural heritage and ethnicity, but it's not limited to it. Okay? So it's very important, as Katy kind of already referenced, that we're biologically wired to enjoy food, especially foods that we associate with the people that we love. Okay, it's an advantage to us as a species to have this attachment to certain foods and foods that we associate with safety, with our people. So these are just some kind of interesting things. In Hong Kong, instead of saying, "How are you?" they start with, "Have you eaten yet?" And communal eating is a human universal, meaning that everywhere across the planet, in every culture, humans eat in groups. And in Western cultures, I'm sure you've heard the term to break bread together means to get to know someone and display a level of trust in them. And some cultures continue to feed loved ones even after death as a show of respect and devotion. So food and how we use food and how we feel about food is an incredibly important part of not just our relationship with our bodies, but our relationship with the people we love, our relationship with the larger culture. And that's one of the reasons why it is so problematic to have people kind of coming in and dictating what food you should be eating or you shouldn't be eating. And that soul food is healthy food. Uh, Traditionally, from Edna Lewis, The Taste of Country Cooking, traditionally seasonal, local, minimally processed, high in vegetables, legumes. Um, the Great Migration from the southern to the northern part of the United States often broke the connection and access to familiar recipes and traditions. Again, this is where oppression shows up in disrupting people's food ways and food cultures, which does harm. And poverty and loss of land ownership led to lack of cultivatable land, loss of hunting and fishing traditions, so that can also cause harm, which then again impacts health, right? As Katy was talking about with diabetes, we understand that that is one of the things that can happen when people and their cultures are disrupted and harmed. And it's really important and I think, Katy, I'm going to ask you to speak to this because I know you're more familiar with this.
So just we're now under 10 years ago, I recommended the Mediterranean diet to all of my patients. You should count your almonds, you should have olive oil, you should one glass of red wine. When in actuality, more recent data, and there was a looking at the study of the Mediterranean diet recommendation, which we recommended to everyone, the Mediterranean diet was only beneficial to financially advantaged Mediterranean men. There were no Black men in that study. So it was ludicrous for us to recommend that diet for folks when it was going to have no impact on them whatsoever. And this has gone on for millennia. The quinoa, which is the new hot ancient grain that everybody wants, has been native to Peru for millennia. And when the Spanish invaders came to Peru, they wanted to control the indigenous population. So they burned the quinoa crops. And now that it's a superfood and being exported to the US, it's unaffordable to the folks who had them. It's a great drug, it's a great medicine, it's a great food, but the folks in Peru who can't afford it.
Yeah, I just want to add to that. One of the reasons why in the colonizers destroyed crops was because they wanted to have the native populations eating wheat, because there was this belief that if they ate like white people, that they would become quote unquote civilized. And that's where the phrase "you are what you eat" literally came from, was this idea by the colonizers in the 1600s and the 1700s, that and this is also one of the reasons why the buffalo in the plains were also wiped out. This idea that we're going to make them more like us and therefore more dependent upon us. And so again, we can see the fallout from the disruption of people's food cultures all the way up into today.
Really harmful to a culture, but a great way to run an economy.
Yes. Yeah. So I hope that we've at least given you some ideas, a taste of these different concepts. But there are lots of what, in honor of Black History Month, especially, we want to make sure that we are highlighting the voices and ideas and work of Black people who in more recent years, I've been doing this work for over 20 years, but I would say in the past decade, we've seen a lot of more people of color and Black people getting credit for the work that they're doing. So we wanted to share some resources. And I was adding slides to this right up until right before this talk. And I could have added many more. So this is a short list. I'm really afraid I'm leaving somebody out that I didn't want to leave out, but this is what we have. So we wanted to share some resources if you want to learn from Black people about um, uh, recovering from diet culture, reconnecting with intuitive eating, or eating in a way that's more aligned with your values and ways of being in the world. So this is just some people, okay? So want to learn more? Here are some folks that we'd like to introduce you to if you're not already familiar. So E.K. Dauphin is a writer, an author. She wrote this really wonderful book on fat and faith, about herself and how religion and culture and diet culture all sort of interact. You can find her at her website, and also she's got a YouTube channel. And has been a HACE oriented, health at every size oriented person for longer than I have. Tigris Osborne, she is the current director of the National Association to Advance Fat Acceptance. Also someone who is a writer, speaker, and author. She co-edited this new book, Weight and Wisdom, which just came out, which is a collection of essays by people who have been working on body liberation and ending anti-fat bias over the years. She's a co-founder of the Campaign for Size Freedom, and she was listed as in Times 2024 most influential leaders in the health and wellness category. And you can find her at Eye of the Tigress on Instagram. This is Shayna Monet. I think that's how you say her middle name, Monet Spence. The nutrition tea is what she goes by. I never miss her newsletter. She's a dietitian, she's a speaker. This book, Live Nourished, is lovely. And she really, I like her because for lots of reasons, but one reason is that she really does a great job of kind of breaking down certain ideas, and she does a lot of cultural commentary about food and culture and anti-diet messaging. You can find her at the Nutrition Tea on Instagram, or the nutritiontea.com is her website. This is Dr. Sabrina Strings, who wrote that really important book, Fearing the Black Body. She has a new book out that I bought, but I haven't read yet. And you can find, and she's a wonderful speaker. I think a couple of her talks you might find them on YouTube. And she also has a website, sabrinastrings.com. Joy Cox. She is a consultant, researcher, author, speaker. She hosts the Fresh Out the Cocoon podcast. And you can find her at Fresh Out the Cocoon yeah, that's supposed to be Fresh Out the Cocoon on Instagram. And her book, which I have several of these books are on my bookcase right here, but this is a lovely book about growing up as a fat Black girl, and creating spaces that are welcoming for her and others. Michael Hayes, he's in New York, Buddha Body Yoga in New York City. He is an expert at doing yoga in ways that work for people in larger bodies. He's has a blog, and his yoga studio offers virtual and video classes as well, which I've had some people tell me they really like. And so this idea that you have to be a certain size to do yoga is just not true. And so he's someone who really can show you why that's not true. Ceres Bonner. She is a leadership coach. She's a consultant. She's strategist. She co-hosts the Body Trust podcast and also co-facilitates the Body Trust certification program, which Katy's a Body Trust provider. And these are folks that have a weight inclusive lens towards helping people take good care of themselves. You can find her at Serious While Black on Instagram, as well as at her Serious Bonner Consulting website. Whitney Trotter, another fantastic dietitian and nurse, and yoga instructor. She is a consultant. Her particular expertise, which I have found really helpful, is in eating disorder treatment for Black, Indigenous, and people of color. The eating disorder treatment world, that's a whole talk in and of itself about how problematic so much eating disorder treatment is when it comes to taking good care of Black and brown people and people of different genders and sexual orientations. And she also has expertise in human trafficking. So you can find her on Instagram and at her website. Jessamine Stanley, as another yoga professional, has written 2 books that are really fantastic. And she founded what's called the Underbelly Yoga Community, which is an online resource for people. And you can find her on Instagram at My Name is Jessamine, and also as Satanic Baby Girl on Substack, her newsletter, which is really fun. Deshawn Harrison wrote the book Belly of the Beast, which is another book that I strongly recommend to people who are interested in understanding better the connections between anti-fatness and anti-Blackness. A Lambda Literary Award winner. He is the co-executive director of Scalawag Magazine. He's currently on the board of directors for the Association for Size, Diversity, and Health, which is home to the Health at Every Size movement. And he co-hosts Unsolicited Fatties Talk Back podcast. And you can find them at their website, DeshawnHarrison.com. And Marcusel or Marky Mercedes is another really amazing writer, particularly looking at how anti-Blackness and anti-fatness shape healthcare research, promotion, and training. So another really important voice in the looking at medicine and health and health treatment. She is also co-hosting the Unsolicited Fatties Talk Back podcast, is an Emerge Fellow currently at San Francisco State University, and you can find her work at her website. And this is Sonia Renee Taylor, who is also a writer. I forgot to get an image of her book, but she wrote the book, The Body is Not an Apology. And she is a poet, and so you can find her on YouTube, some of her, including her poem, The Body is Not an Apology. And this,
Yes, that video of her reading that poem, it's like she's amazing.
yes. This is a lovely quote from her that I'm going to say. Human bodily diversity is a form of natural intelligence. All bodies are supposed to be different because that is the version that is specific to your particular journey. In order to have a thriving world, a thriving ecosystem that works in harmony, we need variance. We recognize that. We know that innately. And yet, because we are so far away from our own sense of inherent knowing of our enoughness, we've constructed a world where that's not true for our bodies. So,
And she has a brand new book out for kids, literally
oh,
parents, that she had a bunch of kids ask questions like, what is a period? And, just those awkward questions that kids ask. And she talks about how to talk about that question with a kid. If you are a parent, it's a great, sweet, great resource.
Awesome. Yeah, and here's her website. And the last thing, I wanted to make sure to include is when we look at the history of fat acceptance, and which is sort of where a lot of this has come from, it's really important for people to know that, and this is from an essay by Sirius Bonner, the early fat activists of the 60s and 70s were very clearly inspired by the civil rights movement, the feminist movement, the disability movement, and the fight for queer rights, among others. It is obvious in the language, fat in, fat power, fat pride, the themes and the end goals. Like other similar struggles, there was a spectrum of hope for outcomes, from legal rights and protections and better treatment to full-on liberation and revolution. So we just want to make sure that we're giving credit where credit is due to the early trailblazers of this work, which were people of color. Unfortunately, a lot because of media and, they didn't have the social media and the technology back in the 50s, 60s, and 70s. A lot of this is lost to time. We can't look it up on the internet because they weren't writing on the internet. But it's there. And we wanted to make sure that they got that recognition. Whoops. Hold on here. Not sure what happened. Let me just get back. Okay, sorry. So we thank you so much for your kind attention today. These are ways to be in touch with us, and a resource for about health at every size and weight inclusive care. And we hope that this has been interesting, if nothing else. And we're very happy to take any questions or comments people have. And I'm going to stop sharing my slides at this time.
Thank you, Lisa and Katie. We're now at the end of the session. If you have any questions, feel free to enter in the chat. One question regarding health at every size. You had mentioned it a few times. Can you share a little bit more about this movement?
Sure. So health at every size is a weight inclusive approach to taking care of yourself. And what that means, what weight inclusive means, is that it's a way of taking care of yourself without a focus on weight loss. So much of the way that we think about health is weight is centered. And if you're not at the right BMI, you should be working on lowering your BMI and getting that right number. And Health at Every Size looks at the research on how unsuccessful dieting is and how risky other, interventions like surgeries and medications can be, and really encourages people, instead of centering and pursuing weight loss, to focus on behaviors you have control over, stress management, acceptance and compassion, and directly maybe working on improving your blood pressure rather than using weight as a proxy to improve your blood pressure, if that makes sense. So it's really encouraging people to be physically active, for example, if you want to, or change up some of your eating because that will improve your blood sugar management, and letting the weight change, if it happens, be thought of as a possible side effect. Because whether your weight changes or not, if your blood sugar's better, you're going to do better no matter what you weigh. Does that make sense? So it's a treatment orientation.
Yeah, and I don't think we even mentioned this, that even if you think that all of this is not real, like 97% of the time that someone tries to lose weight, they fail within 3 to 5 years. 97% of the time. So that is, like, if I recommended a chemotherapy agent on somebody that fails 97% of the time, I should be brought up for malpractice. So diets don't work. And even if somebody does decide to go on a diet to lose weight, 70% of the time they will weigh more than had they not gone on a diet in the first place. So it's ludicrous that we're even recommending a diet for someone to manage their blood pressure, because it's going to fail. Instead, let's talk about how we manage your blood pressure.
Thank you. And for healthcare providers who may be on the call today, what tips do you have on how we can support patients to be more inclusive regarding their weight, size, culture?
Hmm? Sure. Well, the first thing that I would say, speaking as a person in a larger body or a fat person, is don't assume that you know anything about my health history, my self-care, my eating because of the size of my body. Because this happens all the time to people that, someone who is working out regularly and their physical activity is super important to them, but because they're in a larger body, their doctor, I have a colleague who, was training for an Ironman in a larger body, and her doctor, without asking, said, even a 20-minute walk every day might be helpful. And she was like, that's my day off. I just take a little walk. Like I'm training for something. So, if don't make assumptions, except one thing you can assume, I think is fair to assume, is that almost all fat people have had a really bad interaction in a medical encounter. So you can assume this person's probably had some pretty bad experiences, but don't assume anything else. That would be my first. And there is now something called the Association for Size and Weight Inclusive Medicine, awsim.org. That is a new organization growing rapidly of doctors who practice, and doctors, nurses who practice from a weight inclusive model. So if they're curious and want to hear more about the evidence base and, treatment approaches, there's now this new organization they can learn, doctor to doctor.
And also just look around you. Do your patients fit in your chairs? Do you, weigh them as soon as they walk in the door? I mean, I for years, I know if I had stepped on a scale, it would make my blood pressure go up. Like, let's step back and think about how you can meet people where they are and not immediately throw weight into the big picture.
Thank you. You had mentioned the size diversity group at Mass General. Can you share a little bit more about this and all the work that you do?
Sure. So the size diversity group is a multidisciplinary group of people all across Mass General Brigham in different places. And we work together to educate our colleagues about the impact of weight stigma on health and about what weight inclusive care might look like, and also try to offer assistance in consultation around specific, when providers are trying to figure out how to be helpful to someone, or we also would really like to be available to patients as well, who are with something related to their weight and trying to get good health care. So we are small but growing. And we're working on getting a website put up so that people can find us more easily. But we do have an email. And we have been invited over the about 8 years, 7 or 8 years that we've been a group, have just been invited to give talks about weight stigma and how to improve healthcare for experiences for larger body people all over, all sorts of different uh, clinics and groups in the hospital that are interested in figuring out how to do a better job.
That's wonderful. Now, is this group only for staff or can patients be involved in any way?
It is not a patient group. It is for it, not even staff, employees at Mass General. We have non-clinicians that are also in the group. Um, but Katy is work. We have been working on trying to figure out how we can offer a diet recovery group to patients and clinicians alike at the hospital. Because lots of people are interested in taking good care of themselves, but they're really done with the whole weight loss pursuit. And so we want to try and find places and spaces for them to be able to talk about improving their health without feeling pressure to chase a number on the scale. So that's something we hope to be able to provide.
And we recognize that what we talk about is countercultural. Like, we recognize that this is revolutionary. This is revolutionary to my life when I discovered this work 10 or 15 years ago. And so it takes a long time to unlearn this and
Hmm.
to give yourself a little bit of grace and,
Hmm.
reach out to Lisa and I actually,
Hmm.
Jamie, one of the social workers who's on the group with us, Jamie and I we started a little diet recovery group, and it was interesting. We are interested in getting this back up and running and having it be a
Hmm.
little bit more solid, but we are, as Lisa said, small and mighty.
Yep. Can you would it be possible on our last slide? I see someone asking, how can I join the
Yeah,
club? If you on our last slide, we had the email for the size diversity group. And if you could put that in the chat,
great.
um,
Yeah.
be so that people can reach out to us that, that way. Yeah, to Simona, advice when patients are discouraged. Yes. So the first thing that I think important is to validate and acknowledge to people, like, I get why you might be really frustrated, because of course we live in a culture that's saying you've got to be thin, you've got to lose weight. So it's perfectly good idea to validate that and to I get why you're disappointed, but to try and help patients focus on, whether or not you lose weight, it's awesome that your blood glu your glucose is in where closer to where it should be, or even if you don't lose weight, this exercise is obviously so good for your blood pressure, um, or your stamina, and try and help them focus on whether the weight shifts or not, what you're doing is good for you and will benefit, and validate the disappointment, around, when our body doesn't want.
Yeah, you're seizing up a little bit, Lisa. But
Oh, sorry. Am I back?
and to recognize that this doesn't happen overnight. This work, this understanding, but you are not alone, and that we are gaining momentum. And only when you realize that you're not crazy, but that our culture is really stigmatizing.
Mhm.
Thank you. And I had just included the email in the chat for anyone interested.
Great. Yeah,
All
it's
right,
the
so
Huge Size Diversity Group. Or you can find I'm Catherine Wetzel in the website, and Lisa is Lisa DuBreuil. If you want to reach out to either of us via email, we'd be happy to talk and connect, and just to know that that we're here.
thank you. We are at time, but before we end today's session, Lisa, Katie, do you have any final thoughts you'd like to share with the audience?
No, thank you for having us. And while we do feel like it's a little ironic that you've got white ladies talking about Black History Month, I do think it's important that we all understand our history and where we are so that we can move forward and change things.
Yeah, I don't know if you guys can hear me or not.
Yes, yes. Now you're
Yeah.
back.
So were you asking for a last word?
Yes.
So yeah, I would just say to especially, to the white people that might be watching, to be, it's okay to admit don't know, to give yourself permission to be the learner, keep your heart open and your ears open. People are letting us know that's whether it's of a different body size or different race, or when patients let us know that we're not doing something well for them, they're trusting us. Like that is a compliment, that they're trusting that they can tell you this, and to be open to
Yeah.
try and be when we need to do things differently.
Thank you. Perfect way to end today's session. Lisa, Katie, thank you so much for spending the hour with us. This was great.
Thank you. Thank you.
That's great. Thank you. Take care. Bye-bye.
And for everyone joining, thank you so much. As I had mentioned, today's session is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so
Thank
much,
you.
everyone.
Thank you, Addie.
Take care.
Bye-bye.
Thank you.